Hi, my name is Suzanne Miller. I'm a licensed clinical social worker at Mount Sinai.
Hi, everyone. My name is Gretchen Greenlee. I'm a child life specialist at Mount Sinai.
Hi, my name is Danielle Young. I'm a licensed clinical social worker at Mount Sinai.
Hi, everyone. My name is Sophia Levin. I am the chaplain in pediatrics and maternity here at Mount Sinai. So we are a multidisciplinary team of social workers, child life specialists, creative art therapists, and chaplains, and we provide bereavement support to patients and families here at Mount Sinai. We work in both the maternity, perinatal side, as well as pediatrics. So we span a very wide range of ages from supporting families through pregnancy loss all the way up through pediatric loss, all the way up until about 18, 19, 20 years old. And our goal through our work and our programming and our support for families, as well as our support for staff here, our goal is always to build community, to provide supportive services and resources for any family who has experienced a perinatal or pediatric loss, either here at Mount Sinai or in the wider New York community. As a committee, we meet quarterly as a big group, and then we also have subcommittees or working groups that meet on a monthly basis to address the different elements of our program. So, for example, we have a marketing committee, finance committee, programming committee, social media, educational resources, data, other community programming, different subcommittees like that. So that's a little bit how we break up our workflow. And in addition to the work that we provide supporting families through perinatal and pediatric loss, we also provide a lot of educational programming for our staff here at Mount Sinai, as well as supportive resources for our staff.
Our perinatal and pediatric bereavement program provides both short-term individual counseling as well as several groups for bereaved parents and caregivers. We also, throughout the year, hold different evening programs such as the annual memorial service, Mother's and Father's Day services, and a holiday service. And we actually just recently restarted our wellness evenings. In the pandemic, all of our services had actually gone virtually, although some, like our wellness evenings, are coming back in person starting this fall. Although we miss seeing everyone in person, running the programs virtually has actually allowed us to expand our reach to families who may have difficulty with travel or childcare, and so families can choose to tune into these services from the comfort of their own homes. We also provide resources to all of our families, including legacy and memory making, therapy referrals, assistance with funeral arrangements, and developmentally appropriate language, books, and any other tools that families may need. In addition to our programming, we also fundraise in order to continue to support our programming and our funeral fund. And then, as Sophia had mentioned earlier, we also provide support services and groups to our colleagues, specifically around ongoing challenging cases and end-of-life cases, so our services are both patient and staff-facing.
So I think there are really three specific ways that our program is very unique to Mount Sinai, and one being that services like this are very hard to find and few and far between. Every member of our committee is volunteer-based, and it's really made up of clinicians who are very passionate about supporting this population. This program is also free of charge to our families. It does not require any insurance or billing or fees. It is a free resource. And then finally, as you can see represented here on this call, is that it really crosses all disciplines, very grounded in both OB and pediatrics across the board, in social work, child life, and chaplaincy. We also have creative arts therapists, so it's a really robust and dynamic offering for our families.
Glad you asked. You can Google Mount Sinai support programs within OB and the Kravis Children's Hospital. It lives on both websites. We're also on social media. So for Facebook users or Instagram users, on Facebook, you can find us under Mount Sinai Perinatal and Pediatric Bereavement Program. And on Instagram, the handle is at WCH, which stands for Women in Children's Health, WCH Bereavement. We post, sporadically different quotes, resources about our programs, so you know what's going on if you follow either on Facebook or Instagram. Also on our website, we have a comprehensive resource guide with more information about grief and coping. So anyone can find their way to that website and then on their own time kind of educate themselves about what's out there. And specifically for any follow-up questions for any of us or other thoughts, we also have a direct email address for our program. So you can email wchbereavement@mountsinai.org, and you'll hear back from one of the committee members directly.